Let's continue. The full metal crown with facing, or is also called the full veneer crown. In this full metal facing, subject of crown and bridge. The full metal crown with facing full veneer crown is a full metal crown having the labial or buccal surface covered by a tooth-colored material, acrylic or porcelain. This is the full veneer crown, which is a metal having labial or buccal surface covered by tooth-colored material, acrylic or porcelain.
To provide enough space for the metal and the facing material and proximal areas. It can be used on the anterior and posterior teeth. It is not a conservative type of crown because it includes excessive tooth preparation to provide enough space for the metal and the facing material.
This was an introduction of the full metal crown with facing full veneer crown. Maybe we should read this again in order to understand the introduction to this lecture. It is the full metal crown with facing or veneer full veneer. It is a full metal crown having the labial or buccal aspect covered with tooth. Colored material, acrylic or porcelain, it combines the strength of full metal and the cosmetic of the tooth-colored material of ceramic crown or of the veneer crown. The restoration consists of a complete coverage cast metal crown or substrate that is veneered with a layer of fused porcelain to mimic the appearance of natural tooth. The extent of the veneer can vary. It may cover all the axial and occlusal surfaces or restricted to the facial and proximal areas. It can be used on the anterior and posterior teeth, and it is not a conservative type of crown because it includes excessive tooth preparation to provide enough space for the metal and the facing material. Most importantly, that it is not conservative or not a conservative type because it includes an excessive tooth preparation. Let's move next to the history or the historically attempts to veneer metal crowns. We have here the historical attempts to veneer metal restoration, with porcelain having a severe problems. The major challenge was the development of an alloy and a ceramic material with compatible physics properties that would provide adequate bone strength. In addition, it was initially difficult to obtain a natural appearance. Next, the indications. Typical indications are similar to those of all metal crowns, complete crowns with the addition of an aesthetic concern. These are the indications. Improvement of aesthetic carious teeth, malpose teeth, peck-shaped lateral incisor, colored teeth, fracture of tooth, teeth with large filling, a bridge retained, especially in long span bridge, and on odontically treated teeth with sufficient tooth structure. Again, endodontically treated teeth with sufficiently tooth structure. Recontour axial surfaces or correct minor malalignment. The indications, here we can see we have 6 indications for using the full metal crown with facing. First one is the improvement of aesthetic carious teeth in malposed peck-shaped lateral incisor colored teeth. Second, fracture of tooth. Fracture of tooth, this is. Or tooth fracture. 6 indications of using full metal crown with facing or full veneer crowns. Number one, improvement of aesthetic, carious teeth, malposed, peck-shaped lateral and sagittal colored teeth, fracture of tooth, and this is a fracture of the tooth. Teeth with large fillings, as a bridge retainer, especially long span bridge, on identically treated with sufficient tooth structure, is also an indication of using the full metal crown with facing full veneer crown. On endodontically treated teeth, recontour axial surface or correct minor malinclinations. The limitations of using or the contraindications of using the full metal crown with veneer face. The full metal crown with facing or full veneer crown are for all fixed restorations include the presence of active caries or untreated periodontal diseases. This is one indication. Contraindication is the presence of active caries or untreated periodontal disease. In young patients with large pulp chambers, the metal ceramic crown is contraindicated because of the high risk of pulp exposure. Number two, when a more conservative restorative option such as composite resin or porcelain laminate, veneer, or an all ceramic crown with less axial reduction is preferred. Patients with bad oral hygiene is also a contraindication of using the full ceramic crown, the full metal crown with facing, or the full veneer crown. The advantages of using full metal crown with facing is: number one, combines the strength of most metal with the aesthetic of the ceramics. Combines the strength of most metals with the aesthetic ceramics. Number two, the superior strength of the metal ceramic crowns allows their use in higher stress situations and on teeth. And on teeth that would not provide adequate support for non-ceramic restorations. Again, let's read number two very carefully, because I was talking about the metal ceramic crowns and also talking about the ceramic restoration, and not talking about the full ceramic I mean the full metal crowns. With facing So let's read it again. The superior strength of the metal ceramic crowns allows their use in higher stress situations and on teeth that would not provide adequate support for a null ceramic restoration. This is talking about the metal ceramic, but we really should talk about the full metal crown with facing. First advantage was combines the strength of cast metal with the aesthetic of the ceramic. And these are the limitations. These are the advantages. Limitation in young patients, when more conservative restoration options, such as composite resin or porcelain lamina, veneer on or an all ceramic crown with less axial reduction, patient with bad oral hygiene. These are the limitations. Indications: improvement of aesthetic, caries teeth, malimposed teeth. Second, fracture tooth. 3, with large filling, with bridge on endodontically treated teeth with sufficient tooth surfaces, then recontouring axial surface of correct minor malinclinations. These are all the full metal crown first page and the disadvantage. First page about the full metal crown with facing, the full veneer crown, which we talked about the advantage number 2, the superior strength of metal crown, or it should be the metal crown with facing, but instead we talked about the metal ceramic crown. This is the metal ceramic crown, which we should actually talk about the full metal crown with facing. Anyways, the metal ceramic crowns allows their use in higher stress situations and on teeth that would not provide adequate support, etc. Let's read the disadvantages.
Disadvantages: 1. The metal ceramic crown preparation requires significant tooth reduction, non-conservative reduction. 2. Facial margin of an anterior restoration is often placed subgingivally. 4. Aesthetic purposes, which increases the potential for periodontal disease. 3. The difficulty in achieving an accurate shade match, due to the presence of metal. 4. Inferior aesthetic in comparison to all ceramic crown. 5. Because of the glass-like nature of the veneering material, a metal ceramic crown is subject to brittle fracture, although such failure is usually attributable to poor substructure design or poor fabrication technique.
Again, the disadvantages of the metal ceramic crown. This time we are talking about the metal ceramic crown with veneer instead of talking about the full metal crowns with facing. Maybe the full metal crown with facing is the same as the metal ceramic crowns. because we talked about the full metal crown in one lecture and the full ceramic crown in another, but today we are talking about the metal ceramic crowns, or which is called the full metal crown with facing, or the full veneer crown. Anyways, the disadvantages of metal ceramic crowns preparation require significant tooth reduction, non-conservative reduction. This is number one. Number two, facial margin of anterior restoration is often placed subgingivally for aesthetic purposes, which increase the potential of periodontal disease. The periodontal disease. Again, facing margin of anterior restoration is often placed subgingivally for aesthetic purposes, which increase the potential of periodontal diseases. 3. The difficulty in achieving an accurate shade matching due to the presence of metal. The presence of metal does not allow, or it is a difficulty in achieving an accurate shade match due to the presence of the metal. Due to the presence of the metal, interfere aesthetic in comparison to all ceramic crowns, or inferior aesthetic in comparison to all ceramic crowns. All ceramic crowns is better than metal ceramic crown, aesthetically, and the full metal crown probably less aesthetical than the metal ceramic crowns. Number 5, because of the glass-like nature of the veneering material, metal ceramic crowns is subject to brittle fracture, although such failure is usually attributed or attributable to poor substructure design or poor fabrication technique. Again,
5. Because of the glass-like nature of the veneering material, a metal ceramic crown is subject to brittle fracture, although such failure is usually attributable to poor substructure design or poor fabrication technique.
The design of the metal ceramic crown, because of its glass nature and the nature of the veneering material, is subject to brittle fracture, just like the ceramic crown, although such failure is usually attributed to poor structure design or poor fabrication techniques. These are the disadvantages of the metal ceramic crown, or the full metal crown with facing, or the full veneer crown. Let's repeat them. Number 1, the metal ceramic crown preparation requires tooth reduction. It's not conservative. Facial margin of anterior restoration is often placed subgingivally, which could cause periodontal disease. Number 3, the difficulty to achieve an accurate shade matching due to the presence of the metal. Number 4, inferior aesthetic in comparison with all ceramic crown. Number 5, because of the nature of the veneer, it is brittle and poor aesthetic, poor fabrication could cause fracture. The preparation of full metal crown with facing on posterior teeth. This is the preparation of full metal crown with facing on posterior teeth.
Preparation of full metal crown with facing on posterior teeth. The same principle of preparation of the full metal crown should be followed except for the buccal preparation where it should be deeper than that for the full metal crown preparation. This is important to provide enough space for the metal and the facing material, and to get a proper shade of the final crown. The finishing line should be shoulder or beveled shoulder on the labial surface and chamfer on the other surface.
Let's repeat this important information in the second page of this lecture. Preparation of full metal crown facing on posterior teeth. The same principle of preparation of full metal crown should be followed. Here, let's highlight this. Should be followed except for the buccal preparation, where it should be deeper than that for the full metal crown. It should be deeper for the full metal crown preparation. This is important to provide enough space for the metal and the facing material, and to get proper shade of the final crown. The finishing line should be shoulder or beveled shoulder on the labial surface of the chamfer on the other surface. So the finishing line again should be shoulder or beveled shoulder on the labial surface and chamfer on other surfaces. Shoulder or bevel shoulder on labial and chamfer on other surfaces. Let's draw this. This is chamfer. This is the crown. And this is labial surface. And here we can see there is a chamfer or a beveled chamfer margin. Will be bevel, shoulder or shoulder with labial surface. Chamfer on other surface. This is buccal surface. And we can see there is a chamfer shoulder or a chamfer finishing line. Next, the porcelain fused to metal ceramic crown. In this case, the porcelain is fused to the metal as it is metal ceramic crown, metal ceramic crown, and in this case the porcelain is fused to the metal, like the ceramic is fused to the metal. In the metal ceramic crown. Armamentarium, the instrument needed to prepare the metal ceramic crown. Number 1, round, tipped rotatory diamond. Round. Tipped rotatory. This is rotatory. regular grit for bulk reduction, fine grit for finishing or carbides. This is regular grit for bulk reduction, and this is a fine grit for finishing. Next, a football or wheel-shaped diamond. This is a football or wheel-shaped diamond for lingual reduction of anterior teeth. So for the anterior teeth, we use this football-shaped diamond or wheel-shaped diamond for lingual reduction for anterior teeth, and a round tipped rotatory diamond regulated for bulk reduction and finishing. We also use a flat-ended tapered diamond for shoulder preparation. This is a flat-ended tapered diamond. Flat-ended tapered diamond for shoulder preparation. And this is the shoulder or the bevel shoulder preparation on lingual. Of course, we use the shoulder or bevel shoulder. Other surfaces use the chamfer. Finishing stones. These are the finishing stones. Many shapes, different shapes of finishing stones or bores. And explorer or periodontal probe as usual. Last but not least,
Guidelines for preparation. Metal ceramic crown is a combination of metal and ceramic. The tooth preparation is also combination of deep reduction facially and shallower reduction lingually. There may be a wing on each proximal surface where the deep reduction ends and the shallower proximal reduction begins. Figure 2. Adequate reduction is essential for achieving a good aesthetic result. Inadequate space for a sufficient thickness of ceramic material, poorly contoured restoration affecting both aesthetic and health of the surrounding gingiva and the shade end. Translucency of the restoration will not match the adjacent natural teeth.
The guidelines that the metal ceramic crowns, combination of metal and ceramic crown, the tooth preparation also combined deep reduction facially and shallow reduction lingually. Because the lingual reduction uses chamfer finishing line. And the labial reduction uses the bevel or shoulder bevel finishing line. Of course, this is an assumption of why there is a shallow reduction lingually, but it could be wrong. So let's continue. There may be a wing on each proximal surface where the deep reduction ends and the shallower proximal reduction begins. As we can see here, we saw that there may be a wing on each proximal surfaces where the deep reduction ends and the shallower proximal reduction begins. Next, adequate reduction is essential for achieving a good aesthetical results. Inadequate space for sufficient thickness of centric material, poorly contoured restoration affecting tooth aesthetic and health of the surrounding gingiva, and the shading and translucency of restoration that will not match adjacent natural teeth in adequate space for sufficient thickness of ceramic material, poorly contoured restoration affecting both aesthetic and health of the surrounding gingiva, and the shade of the translucency of restoration will match the adjacent tooth or the adjacent natural teeth. This figure showing us the tooth preparation of material of the metal ceramic crowns. Step-by-step procedure. The preparation is divided into 5 major steps. Of course, after we discussed the armamentarium and the guidelines, the preparation, introduction of the metal facing posterior teeth, and we have discussed the advantages and disadvantages in this page number 4 out of 9. This is page 4, 5, 6, 7, 8, and page 9, which is an image. In this page, we will be talking about the step-by-step procedures in the way of the preparation, which is divided into 5 major steps of preparing metal ceramic or the full metal crown with facing. Number 1, guiding grooves. Number 2, incisal or occlusal. Number 3, labial. Of course, all of these steps are important, and we should discuss them one by one in the procedure. And we do the occlusal, labial, lingual, but we did not do the mesial and distal reduction. We do not need mesial or distal reduction. And of course, the labial reduction first, we do it. And then the lingual shallow, then the labial reduction. Deeper reduction. Placing it with the shoulder or bevel shoulder margin. And the lingual reduction will place a chamfer finishing line. Guiding grooves, first step of the preparation. Place 3 depth grooves on the center of facial surface and 1 in each mesiolabial, distolabial line angles, or distofacial, mesiofacial. Cervical gingival place parallel to the long axis of the tooth. This will determine the path. First, cervical gingival plane. That is parallel to the long axis of the tooth. This will determine the path of insertion of complete restoration. Second is the incisal or occlusal portion. Follow the normal facial contour. This will provide the space needed for the porcelain veneer, provide 1.3 millimeter depth to allow for additional reduction during finishing. So first is the cervical gingival. This one here, cervical gingival groove. After we placed the mesiofacial distolabial grooves, we do place the cervical gingival plane that's parallel to the restoration. This will determine the path of insertion of complete restoration to the incisal or occlusal portion. This is number 2. incisal or occlusal groove or guiding groove. That will follow a normal facial contour. This will provide the space needed for the porcelain veneer. Provide 1.3 millimeter depth to allow for additional reduction during finishing. Next step, place 3 depth grooves, 1.8 millimeter in each incisal edge of an anterior tooth. So this one of the facial contour incisal was 1.3. But when it comes to the placement of 3 grooves, they are 1.8 millimeter deep in incisal edge of an anterior teeth. This will provide needed reduction for 2 millimeter and allow finishing when initially positioned. The diamond for the anterior teeth reduction may be helpful to observe the long axis of the opposing tooth in the intercuspal position, so orient the instrument perpendicular to that on posterior teeth where the occlusion is to be established. Porcelain 2 millimeter of clearance must exist. This will include the use of centric cusps bevel, although additional occlusal reduction will be needed where the porcelain to be applied. If the occlusion is to be established in metal, the same minimum clearance are needed as for a complete cast crown. And as we can see here, there is the metal crown, placement of grooves of 2 planes. Porcelain 2 millimeter clearance must exist. This will include the use of centric cusp bevel, although additional occlusal reduction will be needed. After placement of the guiding groove, we do the incisal occlusal reduction. Incisal, let's draw this, incisal or occlusal reduction. The complete reduction, or maybe we should read this quickly.
Incisal, occlusal, reduction. The completed reduction of the incisal edge on an anterior tooth should allow 2 mm for adequate material thickness to permit translucency in the completed restoration. Posterior teeth generally require less, 1.5 mm, because aesthetics is not as critical. Caution must be used, however, because excessive occlusal reduction shortens the axial walls and thus is a common cause of inadequate retention and resistance form in completed preparation because most of the retention is derived from the proximal walls in anterior teeth. Incisal, occlusal, reduction should be done first to allow easy instrument access to the axial surfaces and the gingival finish line. Inadequate incisal reduction results in poor incisal translucency in the finished restoration. Remove the islands of remaining tooth structure between the guiding depth grooves.
As we saw, there is many important incisal occlusal reduction steps. First one is to accomplish reduction of incisal edge on an anterior tooth that should allow 2 mm of adequate material thickness to permit translucency in the complete restoration. This is the complete reduction of incisal edge. Posterior teeth generally requires less than 1.5 mm because aesthetic is not a criteria. Caution must be used, however, because excessive occlusal reduction shortens the axial walls and thus is a common cause of inadequate retention and resistance from form in completed preparation, because most of the retention is derived from the proximal walls in anterior teeth. Next, incisal occlusal reduction should be done first to allow easy instrument access to the axial surface and the gingival finish line. Inadequate incisal reduction results in poor incisal translucency in the finishing restoration. Remove the islands of remaining tooth structures between the guiding depth grooves. Let's hear that.
Incisal, occlusal, reduction should be done first to allow easy instrument access to the axial surfaces and the gingival finish line. Inadequate incisal reduction results in poor incisal translucency in the finished restoration. Remove the islands of remaining tooth structure between the guiding depth grooves.
The incisal occlusal reduction, we can make a quick review on this incisal occlusal reduction just to understand it more.
2. Incisal, occlusal, reduction. The completed reduction of the incisal edge on an anterior tooth should allow 2 mm for adequate material thickness to permit translucency in the completed restoration. Posterior teeth generally require less, 1.5 mm, because aesthetics is not as critical. Caution must be used, however, because excessive occlusal reduction shortens the axial walls and thus is a common cause of inadequate retention and resistance form in completed preparation, because most of the retention is derived from the proximal walls in anterior teeth. Incisal, occlusal, reduction should be done first to allow easy instrument access to the axial surfaces and the gingival finish line. Inadequate incisal reduction results in poor incisal translucency in the finished restoration. Remove the islands of remaining tooth structure between the guiding depth grooves.
Let's finish this time the labial or the buccal reduction. When completed with reduction of facial surface, should have produced sufficient space to accomplish the metal substructure and porcelain veneer. A minimum of 1.2 mm is necessary to permit the ceramics to produce a restoration with satisfactory appearance. With a satisfactory appearance, specification, accomplishment, a minimum 1.2 is necessary to permit ceramic procedure restoration with satisfactory appearance. 1.5 mm is preferred. This requires significant tooth reduction. Then we talk about the labial buccal reduction of removing the remaining tooth structure.
3. Labial, buccal, reduction. When completed, the reduction of the facial surface should have produced sufficient space to accommodate the metal substructure and porcelain veneer. A minimum of 1.2 mm is necessary to permit the ceramist to produce a restoration with satisfactory appearance. 1.5 mm is preferable. This requires significant tooth reduction. Remove the remaining tooth structure between depth grooves, creating a shoulder at the cervical margin. Figure 4. The facial shoulder should extend at least 1 mm lingual to the proximal contact, to ensure aesthetics. Proximal flange will be produced. Figure 5.
Quick review on what we have discussed. When a labial buccal reduction, when completed or upon the completion of, or after completion, after we complete, then the reduction of the facial surface should have produced sufficient space to accommodate metal structure and porcelain veneer. Minimum of 1.2 millimeters insert to permit a ceramic procedure restoration with satisfactory appearance. 1.5 millimeters preferred. This structure significantly or with significant reduction of the tooth. In this paragraph, talking about removing the remaining tooth structure between depth groove, creating a shoulder at the cervical margin. The facial shoulder should extend at least 1 millimeter lingual to the proximal contact to ensure aesthetic flange will be produced. Here in these pictures, as we can see, there is a very clear showing of the occlusal reduction. And many other reductions. We can see here, although the resulting wings of teeth structure can provide, this is all about the resulting wings of tooth structure, which can provide some resistance and retention that is not primarily primary. Some resistance, and that is not primary reason for the. This is not the primary reason for their existence. But secondly, they can conserve tooth structure. These wings, the resulting wings of tooth structure, can provide resistance, retention, conserve tooth structure for aesthetic purposes, all of which the wings that can provide. Next, we have this paragraph. Form a periodontal point, from a periodontal point or periodontal view, supragingival margin is always preferred. Its application is restricted, however, because patient often objects to a visible metal color discolored tooth surface. Such objections are common even when gingival margin is not visible during normal function, as in patients with a low lip line. This generally limits the use of supragingival margin to posterior teeth and to undiscolored anterior teeth. Where a subgingival margin is to be placed, careful tissue manipulation is essential, otherwise to that which leads to permanent gingival recession and subsequent exposure of the metal collar. I think we should read this quickly with automation voice in order to understand what is the meaning.
3. For aesthetic purposes. From a periodontal point of view, a supragingival margin is always preferred. Its application is restricted, however, because patients often object to a visible metal collar or discolored root surface. Such objections are common, even when the gingival margin is not visible during normal function, as in patients with a low lip line. This generally limits the use of superior gingival margins to posterior teeth, and to undiscolored anterior teeth. Where a subgingival margin is to be placed, careful tissue manipulation is essential, otherwise, there will be damage that leads to permanent gingival recession and subsequent exposure of the metal collar.
Here in this picture we can see these wings that has been provided by the dentist in order for the subgingival to be placed in, and many times the patient resists or not accept the placement of the wings. Patient or the patients resist placement of the wings, and of course this is because of aesthetical reasons. This is from a periodontal point of view, supragingival is always preferred, but application is restricted. And here we can see that the facial shoulder should extend at least 1 millimeter lingual to the proximal contact area. Again, the facial shoulder should be restricted to 1 millimeter. Here, as we can see, that the facial shoulder must be restricted to 1 millimeter. Next, the axial reduction of proximal and lingual surfaces. Here we have the axial reduction of the proximal and lingual surfaces. Deficient tooth structure must be removed to provide a distinct smooth chamfer of about 0.5 millimeter width. Again, sufficient tooth structure must be removed of the axial reduction to provide a distinct smooth chamfer about 0.5 millimeter width. Then reduce the proximal and lingual surface of the diamond held parallel to the intended path of withdrawal of the restoration. Taper proximal 6 degrees in is recommended. Of course, always a 6-degree taper is recommended in this case. Next, for anterior teeth, usually only one groove is placed in the center of the lingual surface. This is usually one groove is placed on the center of the lingual surface, only for the anterior teeth. This picture is showing lingual fossa reduction by wheel-shaped diamond. This is the wheel-shaped diamond. And the lingual fossa, which is being removed. And the axial reduction of the lingual and proximal reduction. Next, we have these paragraphs, 2 paragraphs. First one is for molars, 3 grooves can be placed similar to that described for the complete cast crown. Use round-ended diamond. Make a lingual alignment groove by positioning the diamond parallel to the gingival plane of the facial reduction. It will be almost halfway submerged into the tooth structure and carry the axial reduction from the groove along the lingual surface into the proximal surface. As lingual chamfer is developed, extend it buccally into the proximal prepared into the proximal blend with interproximal shoulder blades. Earlier, a lingual chamfer prepared to allow adequate space for the metal. Next, we can see this paragraph. Interproximal margin should not be inadequately placed too far gingivally and thereby infringe on the attachment apparatus. It must follow a soft tissue contour and the lingual aspect of the proximal axial wall as well as the lingual surface is reduced with a torpedo diamond accentuation the chamfer of the lingual and proximal surface. Next page. This is the last page, of course. We have the finishing. Let's read it quickly. And maybe we can understand it after we read it with the text to speak.
Finishing. 1. The margin must provide distinct resistance to vertical displacement of an explorer tip. It must be smooth and continuous circumferentially, like smooth glass slab. 2. All other line angles should be rounded, and the completed preparation should have a satin finish free from obvious diamond scratch marks. 3. Finish the margins. Finish line, with diamonds, or carbide of fine grit, with slow speed. All internal line angles should be radiuses to facilitate the impression, making and pouring steps. 4. Round all sharp line angles within the preparation. This will facilitate all subsequent procedures of crown fabrication, using slightly larger torpedo diamond to finish the walls and chamfer finish line. This is because the greater diameter of a tip will prevent ditching, of the chamfer and ensure removal of any blend all surfaces together, and remove
all subsequent procedure crown fabrication slightly with a torpedo, etc. Of course, to the end of this paragraph. Very important. It's right here, important information. Important. Information of this full metal ceramic crown. Moving to the evaluation, which is also an important procedure that we should do. Avoid creating an undercut between the facial and lingual walls. Of course, avoiding an undercut or creating an undercut is very important. Next, excessive convergence should be avoided because this may lead to pulp exposure. Pulp exposure because of the completed chamfer should provide 0.5 millimeter space for the restoration at the margin. The chamfer should be continuous with the intraproximal shoulder. And at last, we have the preparation on canines. FVC on canines. The same step preparation FVC on incisor are followed for canines with only two exceptions. Number 1 and 3. First, well, we have discussed the labial walls here, labial buccal reduction, labial buccal reduction. Next, we looked at the incisal occlusal reduction, which was the first reduction.